Good evening. My name is Alan Andrade. I'm a physician here at Mount Sinai Hospital in the Department of Geriatrics and Palliative Medicine. My job involves dealing with some very seriously ill people, many of whom are at the end of their lives. I've had to treat their pain and their fatigue. And I work with a group of people, part of whom provide mindfulness, mind-body techniques to help these people who are sometimes really suffering. And what I found through my experience is that these mind-body interventions work. They help people reduce the need for opioids and medications. And I myself have actually experienced that firsthand when trying these mindfulness techniques. The issue that I found is that I don't have enough resources I have only so many staffs and have so many patients who need this important technique of mind-body and spirit healing. And what I envision doing is prescribing this as a form of an app that can deliver this to patients who are in the hospital who can really access it when they're in bed and have nothing else to do. So I'm hoping any of you would join me in developing this application. Thank you.
So that was project number 1. Do we have someone from project number 2 here? David, okay.
What we're developing is a chronic pain capture app. What that means is something that allows the patient to communicate in real time their pain experience to the provider that will go into the provider's dashboard and integrate with all the electronic data records that the patient has. And the interface is a three-dimensional image of a body where the patient just puts their finger on where it hurts, and they'll be able to describe the pain. And, well, that's it.
All right. Any gaps in your team?
Oh, I'm sorry. We have several brilliant people already, but what we don't have is a clinician who deals with pain patients, because what we're going to focus the demonstration app on diabetic pain, and we would like to have it a sample dashboard so that with clinically relevant information about A1C, blood sugar, and things of that sort. But we need some guidance on what will be most clinically relevant to the provider. Okay.
Number 3.
Hi. So I spoke before at the problem pitch, which was a problem and a solution a little bit as well. We do need more team members, especially on the software development side. We have Joe, who's an engineer, but if anybody has a little bit of expertise in BLE, low energy Bluetooth technologies, and embedded systems and IoT frameworks, that's also really helpful. Well, we're probably going to prototype using Arduino technologies, and if we have time, we'll make some sort of app, but obviously maybe we'll start with user experience, so also user experience, people who can help us sort of make a mock-up for the app, as well as maybe clinicians who have access to patients who are willing to do this. These type of technologies have already been shown to be safe, so it's a matter of having a patient population who's willing, to do something like this and record in an app. So, is there anything else that I should add?
Maybe remind them what it is.
Yep. So the idea is that we want to be able to do light therapy to the brain, which usually involves having to penetrate the skull, which means it's probably going to be infrared, and ability to measure that exposure while also keeping track of the symptoms that are relevant. Okay. Thanks.
Number 4, VR, virtual reality analgesia. Anyone here from that? We have oh yeah, okay. Mitch, I see you are on this team. You're not? All right, I'll have to. Okay, so this group's working on virtual reality platform to create immersive computer simulated 3D environments. VR, so to reduce chronic pain by integrating multisensory virtual reality inputs. And they're looking for hardware engineering and a clinical mentor. So if anyone's interested in this group, you can contact them. Find their name here on the owner of the card here, and see if you can find them on Slack. You can just message them and on Slack. And they'll be back tomorrow. Number 5, where's that? It might not be. Okay, so we might just go to number 6. Number 6, it looks like you have a full team, but you can maybe just present your solution anyway to the group. Sure. Okay.
Okay. Sorry, I was having a great conversation. Hi, everybody. My name is Kevin. We're working for Group 6, and we have a great team, some developers, and 2 extraordinary physicians. And what we're trying to develop is very similar to this gentleman right here, basically a 3D pain app that logs pain instantaneously and then presents that in a very usable form for the physicians. And the patient population that we're going to focus on is children with sickle cell disease. And if you don't know, sickle cell disease is a major cause of severe pain in children, and this causes them to have multiple hospitalizations and lose valuable time that they could have just being kids. So we want to prevent that. We want to prevent these acute problems before they come up by having this app. And yeah, so that's our mission, alleviate pain in children. Thank you.
Number 7, we have the Smart Independent Drug Delivery System.
Hi. So our product is targeting the epidemic of opioid abuse. So we're targeting it from the prevention side as well as from the withdrawal overdose side. For example, we're trying to propose a delivery system, a wearable device that will be able to detect when people are in pain and when they are, and to deliver the appropriate amount of dosage as well as medication to not build tolerance, preventing abuse in that way. The idea is to develop a rotating device that would deliver different opioids to prevent tolerance. So that's the preventing abuse side. The other side of preventing relapse and preventing overdose is we're going to monitor whenever they have relapse symptoms, or not relapse symptoms, withdrawal symptoms, and again, deliver the opioid substitutes that will be able to maintain sobriety at the right dose at the right time. And as well as we can also detect overdose if they are, or if their vital signs, if their symptoms are indicative of a potential overdose, then we'll be able to give an antidote to that. So this device will have, we imagine it to be a device that has 3 rotating medicine that can help in all areas of opioid delivery. And we're looking for people who can help us in terms of developing the software, the user interface part of it, and developing the software that will correlate with the tracking or wearable device to the software platform.
Number 8, chronic pain tracking app. We have John or Taylor, anyone? Any of these people here? No? Okay. This might be one of the early, maybe they left early today. Number 9, multidimensional pain scale.
Hi, my name is Mandy. We're interested in making a multidimensional pain scale, possibly linked to a wearable app. So this is something that would be based off of passive measurements that we can take from the patients that could be tracked in real time. So we could also correlate that with input from the user on the pain that they're experiencing to possibly find triggers for pain. So this is something we can use over time to find a baseline, and then this could be reported back to their physicians. So we would like to make hardware off of this so we could actually take the measurements from the patients. And so right now we're looking for software developers to join our team, and we are sitting in the back of the room in the center. So thank you.
Before you guys leave, one thing that you will have to tell me your team name and team member names, team names, and email address. So I'm just putting my mail ID over here. Please send me this information for all your team members.
So make a note of that somewhere so you can send that as soon as you finalize your team formation. The team doesn't need to be finalized. If you already have, a partially formed team, you can start sending in your team name and members. And another note, if you're still looking for a team and any of these sound interesting, you can just go on to Sparkboard on the card, and there's a questions and comments thing. Just send a message to the team and let them know that you're interested. That's one way to contact them. If not, to find them in person or on Slack. Yeah, so we'll have some time after this to mingle. And if you know right now, as the pitches are going on, you can feel free. The other thing. Everyone got that? With what? Right. And if you're having trouble finding a team after the end of this, at the end of the night, then just let us know. We'll figure something out. And where are we? 10. So number 10, we have less meds.
Hi, my name is Andres. I'm a digital health entrepreneur myself. Been working on a company for about 4 years. And less meds, which is what we call it, really comes from personal experience. I had tonsillectomy performed on me 10 years ago. So I got all these basically, something similar prescribed to me, out of which I only actually consumed one, which was an antibiotic. And this Tuesday, our CTO actually also had tonsillectomy and a couple of other small procedures done to him, and he got basically prescribed this exact same thing. And so far, he has consumed 2 of these and probably won't consume any of the others. So hence the name Less Meds. The solution really is to create an app that will let you self-report, basically non-adherence, in a kind of a positive way. And then we'll feed that back into, and your anonymized patient data goes with it, who you are, your basic vitals, I guess. And that will let future patients, pharmacists, potential also clinicians make more informed decisions. And so we're literally looking, I think, only for, a clinical champion to kind of back this up. Hopefully we're not completely off track with the idea. Maybe a pharmacist. I'm not sure if they would like the idea. At least their owners wouldn't like the idea. And maybe a visual designer. So that's it. Thanks.
Hi, I'm John Ezra. I'm a data scientist. I presented the problem earlier, which is that I was a lower back pain patient, and the MRI was really expensive, and I got referred to an out-of-network physical therapist, and it wasn't sure whether I would do 3 or 4 sessions. So I really want to create a living document that's a communication channel between the provider and the patient. And then over time, I want to automate the response process. So I'll have bots that respond to patient comments or questions, so that it's more real time in response. So I'm looking for developers, designers, or just anyone who's interested in maybe machine learning or artificial intelligence. Thank you.
Another lower back pain project here. Maybe we can. Anyone from this team? All right, cool.
Hi, everybody. I'm George Marsloff, rehab medicine resident at Sinai. So millions of people suffer from low back pain, and a large component of low back pain is oftentimes the muscles around the back, or the muscles around the low back and the spine. What happens is when the spine is injured, or the vertebrae, the bones around the spinal cord, the muscles will kind of have a response to guard and get very tight. So this tightened muscles just kind of provide a feed-forward problem, causing more pain. So our idea is to use biofeedback, which has been used since the 1950s for low back pain, but let's modernize it for the modern high-tech world. So we're gonna use electromyography, which measures how tense your muscles are on the back, and then we want to send that data to multiple things in your environment. So not just a small biofeedback device that maybe like a vibrational toy or something. We'll do something like that will change a person's room at home or change a person's hospital room, and see if we can change lighting, sound, music, and we can send this data, push it to Health Cloud. We can have providers see what's going on there. So that's our plan. We have we basically have hardware, software, and clinical representation on the team. So we're pretty good now. But yeah, I guess that's it. Yeah.
All right. Cool. All right.
Hi, I'm Kip. I'm an MD PhD student here at Mount Sinai. As we heard kind of extensively today, there's an opioid addiction epidemic in the United States currently. So one particular situation that clinicians face a lot is, especially as a primary care physician or in the emergency department, patients will come in and they'll say that they're in a lot of pain and they need medicine. Now, as a clinician, you definitely don't want to turn anyone away who could benefit from like pain relief. But at the same time, sometimes people can have substance use disorders, and so you don't want to needlessly contribute to that disorder as a physician. So we're hoping to use, with information from the cloud, as well as physiological measurements and probably biosensors, to build a machine learning predictive model that can be used by clinicians to assist their decision as to how they should treat this type of patient. So there's 3 of us right now. I think we're pretty good, but if anyone really is interested in this, they can definitely come talk to us.
And 2 more. Number 14, the pain exercise tracker. All right.
Good evening, everybody. So my name is Sadiq. I'm a graduate student at the City College of New York, and kind of the reason why I'm here today is because I'm a brother of a chronic pain patient. He suffers from CRPS, complex regional pain syndrome, for like 3 years. So I see it on a daily day-to-day situation, what he has to go through and how that's taken away his ability to walk, and how pain patients have to go through much more than just pain. They might lose their range of motion and stuff like that. So while researching for treatments, sadly, there aren't many medicines that are really effective for chronic pain, but one thing that a lot of doctors agree with is that exercise or physical therapy is really important, not just to not lose that range of motion, but also to treat that pain itself, because it's been proven exercise helps forms natural painkillers in the body, endorphins and whatnot. So I was thinking about building an app where patients can first input their pain score kind of thing, where they answer a series of questions about like, where is the pain located in your body? Is it emotional stress? So we can differentiate between like physical pain and emotional pain. And then after that, I was thinking about a place where they can also register their amount of daily activities and their daily exercise and what they're doing to help fight the pain, help beat the pain. So it's a way to motivate patients to keep on exercising. And I think it could be really compatible with a lot of these new information with Salesforce and Health Cloud. And as you can see, I'm a team of 1, so I don't really have a team. But if you're interested in this idea, or if you're willing to merge this idea with your own idea, let me know, and I'm looking for anybody. Thank you.
I mean, I can just click on it, I guess, right? Yeah? No?
Get you. Number, the last one?
15 or
Yep.
something, right? That one.
Perfect. Where's the touchscreen?
Yeah, it's the one that doesn't have any pictures on it, because I'm terrible at this.
All right.
Okay, as you can tell by how rudimentary this page is, I'm not great with technology, which is why I have a technologist in my group who's not me. I wanted to tackle healthcare professional fatigue because I have a lot more experience with that as I'm not a clinician, I'm a layperson, I'm an HR professional. So what I've seen, I work for our system of HIV clinics here at Mount Sinai, and so there are 6 of them across 4 different hospitals, so many, many systems. And it's really hard for us to get providers through the human resources pipeline into their seats and as practicing as billing physicians in a reasonable amount of time. Some of the wait times I've seen have been upwards of 6 months, and I don't know about you, but I have never met anybody who's given 6 months of notice. So this is creating understaffing, it's creating huge gaps in coverage, and ultimately we're not serving our patients, and our providers are all exhausted because they're taking double and triple their patient load as they cover vacancies that sit open while we've got hired doctors, but they're just not sitting down yet. So my plan to solve this would be to build an effective human resources platform that's actually interactive for the 3 players that make this process happen. So that's the providers themselves, obviously. I can't get your diploma unless you give it to me. The HR professionals like myself, and then also the credentialing professionals, because in a hospital, if you don't take any insurances, you're effectively furniture. So those 3 teams working together in a living repository eliminates redundancies, will create cross-communication and collaboration so we can all get together and get things done, and serve our patients, which is really what we want to be doing, right? So right now, we have an end user, which is great. We have a technologist. We have me, who I guess is like the roadmap. I don't know. I have a red dot because I couldn't think of anything else. And then we have a designated hitter, I guess, a swing member. So I'm really willing to take anybody because a lot of this is really about the feedback. I need people to tell me, like, that's terrible, that's stupid, that's a waste of time, like, narrow it down. So anybody who's interested in this is welcome to join. Thank you.